Hello friends, let us discuss about local anesthesia. Local anesthetics are the drugs which upon topical application or local injection cause reversible loss of sensory perception, especially of pain in a restricted area of the body. In local anesthesia, there is reversible loss of sensory perception. What is the mechanism of action of local anesthesia? Local anesthetics produce anesthesia by inhibiting the excitation of nerve endings or by blocking the conduction in peripheral nerves. This is achieved by reversibly binding to and inactivating sodium channels. The open state of sodium channel is the primary target of local anesthetic molecules. Local anesthesia blocks the sodium channel. Classification of local anesthetics. These are mainly divided into amino esters and amino amides. Amino esters are metabolized in the plasma via pseudocholinesterases. What are the examples for amino esters? We have benzocaine, chloroprocaine, cocaine, procaine and tetracaine. Amino amides, these are metabolized in the liver. What are the examples for amino amides? We have bupivacaine, lidocaine, mepivacaine, prilocaine and ropivacaine. How to remember which is amino ester and which is amino amides? In this amino esters we have only one I. So in the example is there is only one I. We can remember like that. Whereas in amino amides we have two I. So in the examples also there are two I's. One of the important example for local anesthetic is lignocaine. What are the indications? Lignocaine without epinephrine is indicated for retrobulbar block, transtracheal anesthesia, intravenous regional anesthesia, that is Bayer block. Lignocaine with or without epinephrine is indicated for caudal or lumbar epidural block, dental infiltration or nerve block. Lignocaine with dextrose is indicated for subarachnoid block. The onset of action is rapid, usually within 3 minutes, and it is short acting. What are the uses of lignocaine? It can be used as surface application. It can be used for infiltration, nerve block, epidural anesthesia, spinal anesthesia, intravenous regional block, and it can be used as antiarrhythmic. What are the compositions of lignocaine? We can use as 4% topical solution, 2% jelly, 5% ointment, 1 and 2% injection with or without adrenaline. It can be used as 5% heavy for spinal anesthesia and we can use it as spray. What are the adverse effects of lignocaine? There is circumoral numbness, abnormal sensation in the tongue, dizziness, blurred vision, tinnitus followed by drowsiness, dysphoria and lethargy. Bupivacaine. It is long lasting. What are the indications for bupivacaine? Bupivacaine without epinephrine is indicated for retrobulbar block. With or without epinephrine, it is indicated for caudal or lumbar epidural block, local infiltration, peripheral nerve block and sympathetic block. What are the uses of bupivacaine? It can be used for infiltration, nerve block, epidural and spinal anesthesia. Bupivacaine 0.25% generally produces incomplete motor block, so it is used as analgesic. Bupivacaine 0.5% produces motor block and some muscle relaxation. Bupivacaine 0.75% produces complete motor block and complete muscle relaxation. What are the side effects of bupivacaine? Bupivacaine is cardiotoxic. It can cause prolonged cardiovascular depression and arrhythmias. Advantages of adding epinephrine to local anesthesia. What is the mechanism of action of epinephrine? It causes vasoconstriction, so there is decreased blood flow in the area of injection. What are the advantages of adding epinephrine to local anesthesia? It prolongs the duration of action. It lowers the serum concentration, so there is decrease in risk of systemic toxicity. And vasoconstrictors may also reduce the bleeding when injected at the site of surgery. Local anesthetics with epinephrine is usually not preferred in tissues supplied by end arteries like fingers, nose, toes and penis. And it should not be preferred in tissues with compromised blood supply because it causes ischemia leading to gangrene. So in any procedures involving fingers, nose, toes, penis, we should not use epinephrine along with local anesthetic. What are the techniques of local anesthesia? It can be used as surface anesthesia, infiltration anesthesia, conduction block, that is field block and nerve block. It can be used as spinal anesthesia, epidural anesthesia and intravenous regional anesthesia. First one is surface anesthesia. It is produced by topical application of drug to mucous membrane and abraded skin. In this, only superficial layer is anesthetized. There is no loss of motor function. Onset and duration depends on the site and drug and its concentration. Next one is EMLA, that is eutectic mixture of local anesthetics. This is a unique preparation which can anesthetize intact skin after surface application. Infiltration anesthesia. Local anesthesia is infiltrated under the skin in the area of operation. It blocks the sensory nerve endings. Onset of action is almost immediate. Infiltration anesthesia is often used for minor surgical and dental procedures. What are the uses of infiltrative anesthetics? We can use as subcutaneous infiltration, usually in IV placement, superficial biopsy or suturing. It can be used as submucosal infiltration, usually in dental procedures and laceration repairs. It can be used in wound infiltration, post-operative pain control at the incision site. It can be used as intra-articular injections, that is post-surgical pain control, arthritic joint pain control. It can be used as infiltrative nerve blocks, usually ankle block, scalp block or digit block. Conduction block. Local anesthesia is injected around the nerve so that area distal to injection is anesthetized and paralyzed. Choice of local anesthesia and its concentration is decided by the required duration of action. Most commonly used anesthetic is Lignocaine with intermediate duration of action. For longer action, we can use Bupivacaine. Next one is field block. Field block is a method of providing anesthesia to a relatively small area by injecting anesthetic solution across the path of nerves. Instead of injection being made directly into the area of procedure, it is made into the soft tissue some distance away where nerves are situated. Advantages include longer duration of action and there is no distortion of operative field. In this field block, we are giving local anesthesia at a distance from the operative site where nerves are situated. While local anesthesia fails to achieve adequate analgesia in inflamed tissue. Inflammation lowers the pH of tissue. Greater fraction of local anesthesia is in ionized form, hindering the diffusion into axolemma. And there is increased blood flow to the inflamed area. So, local anesthesia is removed more rapidly from the site. And effectiveness of adrenaline injected with local anesthesia is reduced at the inflamed site. And inflammatory products may oppose the local anesthesia action. There are different mechanisms why there is no effect of local anesthesia in inflamed tissue. One is inflammation lowers the pH of tissue. So, the local anesthesia cannot enter the axolemma. Second one is blood flow to the inflamed area is increased. So, local anesthesia is removed faster. And effectiveness of adrenaline is reduced at the inflamed site. And inflammatory products oppose the action of local anesthesia. Next one is nerve block. Nerve block is the infiltration of a local anesthetic near the nerve branch supplying the sensation to a particular area. Blocking a nerve provides longer duration of anesthesia than that obtained with local cutaneous infiltration. The muscles supplied by the injected nerve or plexus are paralyzed. In this nerve block, we are giving local anesthesia near the nerve branch supplying the sensation to particular area. Next one is ring block. This is one of the routinely used block. Digital block is the most common nerve block technique. It is frequently used in emergency department and primary care settings for various procedures. For examples, laceration of finger or toe, nail removal, nail bed repair, paranoia, removal of foreign bodies and any other painful procedures on digit. For any procedures on digit, we will use ring block. What are the systemic effects of IV injection of local anesthesia? CNS effects are lightheadedness, dizziness, auditory and visual disturbances, mental confusion, disorientation, shivering, twitchings, involuntary movements. Rarely we can see convulsions and respiratory arrest. This can be treated by diazepam. And cardiovascular toxicity can also be seen. We can see bradycardia, hypotension, cardiac arrhythmias and vascular collapse. And hypersensitivity reactions like rashes, angioedema, dermatitis, asthma and rarely anaphylaxis can occur. So this is in brief about local anesthesia. Friends, if you like this video, please click like button and share this video to your friends and subscribe to my YouTube channel for more videos. Thank you.